Hello and welcome to RUMC Vital Signs. My name is Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning, full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit www.rumcsi.org. Last episode, we were joined by Marty Phillips, director and founder of Richmond University Medical Center's Family Care and Support Program. The program offers patients and their families care and support with problems related to their cancer diagnosis, including the mental and emotional toll such a diagnosis can have on the individual and their loved ones. Marty's joining us again, and today he's also joined by two cancer survivors that have found help through the program, Rosaria Karsis, sorry, and Kelly Careres.
Careres.
Careres. Sorry, I butchered your name. I apologize.
It's okay. It's not the accent, it's just...
Well, welcome back to the show, Marty. It's good to have you. Thank you for joining us today.
Thank you.
So I guess we can start. Just tell us a little bit about each of your own personal journeys. When did you find out that you had cancer, your initial emotions, and then where are you today?
Well, mine started in 2019. I went on a vacation time to Argentina, and I caught a very big cold, whatever it was. I have a lot of friends that they are doctors over there, because I study medicine over there. And he's a gynecologist, and he's telling me, I want you to take an x-ray on your chest. You know, it was kind of funny because I'm a gynecologist sending you for a chest. But anyway, I went to the place, and they have the machine, the x-ray machine, maybe the first one that they invented. And he saw the x-ray, and he's telling me, as soon as you get to the States, I want you to see a pulmonologist, a real doctor, not a regular doctor. Has to be somebody specialized. I said, but what do you see? He said, I can't really say because I'm a gynecologist. That was the funny thing. I followed his steps, and I did. And I saw different ones. I did have cancer on my left lung, on the bottom lung. At that time, then, I was introduced to Dr. Harris, my surgeon, which is still my surgeon until today. And he just removed the lump or whatever was there, and there was no need of chemotherapy or anything. But then pandemic came, and then was no time to go to the hospital to do the follow-ups or to talk about whatever was there. When pandemic was a little better, they rushed me to do the test analysis and everything to find out that my upper lobe was with cancer, including some of the lymph nodes. Dr. Harris immediately removed the lung, and they put me at 1,000 with Dr. Forte at that time, and I'm continuing now with Dr. Safer, and I did my chemotherapy there for a few months. I did a lot of treatments. And then I was really depressed, down and everything. I didn't want to see nobody. Nobody wants to see me the way I was reacting towards the chemotherapy. And I found this guy here calling me. I didn't even know whom he was or whatever, until one day I decided to answer him. And then he said, we had to talk maybe, you know, to help you out. Before you know, I decided, okay, I'm going to talk. I'm part of the group now, and I found those Kelly and Colette and other people that they are not here right now, but I call them my angels because they put me back on talking, like I'm talking now. They make me feel that cancer is over. I mean, I don't have it no more. It may come back, maybe, I don't know, but I know who's going to take care of me now. And I have the help of everybody. And here I am. I'm still alive.
God bless. Kelly, what's your story?
2018, I was diagnosed with ovarian cancer. And I was going to another doctor's office that they misdiagnosed me. They said it was gas.
So you had symptoms or you had no symptoms?
I had symptoms. I had like a 58th girth with ascites. And I went to Dr. Tubman's office. And she's the one that diagnosed me, sent me to RUMC. Dr. Sorora did my surgery. A lovely oncologist nurse, Doreen, was wonderful and fabulous, and then I ended up in Dr. Florenza's hands, and I'm in remission. 6 years.
Oh, that's great.
Yeah, 6 years.
That's great. And how did you hook up with Marty?
Well, it was like 2.5 years in with Dr. Florenza, and I just got tired of being a cancer patient. And I gave a few explicits, like, when am I ever going to get over this blankety blank, feeling this way? I was really angry, because when you're a cancer patient, you're just constantly reminded that you're a cancer patient.
Yes.
And I was done. And because I just feel the diagnosis doesn't define you, you define the diagnosis.
When you
And-
say that you're constantly reminded that is that from people the way they are around you? Is
No,
it a
going-
mindset that you get into?
Going to the doctor's appointments every month, and then you go down to 2 months, then you go to 3 months, and then you finally get to 6 months, and you're just like, can we just go to a year? You know? And you're constantly reminded when you're walking into that office what you've gone through and your journey. And then people have different stages of where they cope and where they're at. But I guess it was pretty progressive, because I have a strong faith in my faith and healing. And that I was just like feeling, I'm done with this cancer. I want to move over. I would just stop talking about it. I want to heal, and I want to start living, because that's your other opportunity when you have cancer. You have to live.
Right. And Rosaria, was your same situation?
I had a happy moment when I went back to the hospital and they removed the port that I have here. And then everybody was applauding and everybody so happy. And the technician, whoever did that, he said, do you know that you are the first one who came to remove it? Because too many, they come to get it in and we never see them coming to get it out. So for me, that was, this is the point. I made it, and I'm going to keep going.
Yep. Put that in the rearview mirror.
Yes.
Exactly. And when you first found out, I mean, what was your family's reaction? I mean, I imagine that's difficult to.
The family is, they worry, like
Sure.
my direct family. I lost my husband 31 years ago, so they don't want to lose the mother
Sure.
at this moment. So they were all worried. They were all trying to find out what was going on. My daughter talking to all the doctors, my son leaving work and staying with me. And at that moment, I didn't care what they were doing. But that was what gave me the strength to continue. And then I have granddaughters, grandchildren. And then I found those people. So it put me back to see I am abnormal again. Because being normal, that wouldn't help. Being abnormal, that's the way I was in the beginning.
When you were talking about your situation and your situation, in the last episode, Marty and I talked about this PTSD, and
That's what I was
you
thinking.
actually sounded just like what he defined PTSD to be like. And Marty, just for the sake of our viewers, didn't see, explain what that PTSD is.
Yeah, most people think of PTSD as post-traumatic stress disorder, but what we were speaking about was prolonged traumatic stress disorder. It's the ongoing treatment and doctor's visits and lab work and possibility, if not reality, of relapse, and it very subtly takes over your life. Your life is controlled by cancer treatment, so you want to get away from it. And it's similar to what you just said also, is that once that port comes out, you don't want to be normal. You want to be healthy. And what does that mean? What does healing mean? What does being healthy mean? Focusing on what else is important in your life now that you have your life again, now that you have your health again.
It's important.
Talk a little bit about the type of person you were when you first started with the program and where you are now in life and how the program has got you there.
Me, I'm happy now. I'm talking again, and I'm not feeling like, oh, they know I have cancer. What am I going to do now? I want to stay away. They may think it's contagious or whatever. And it's not, because I never smoked to begin with, never. And I got cancer. What about those people who smoke and they don't get anything? And I was saying, and they are going to look at me like, what is she talking about? But I didn't care anymore. And those people helped me to see the reality, I made it, I'm here, and if it's coming back again, I have the right people to help me.
It seems simple.
I feel like my mess is my message. People that are going through struggles and situations and hardships, by coming here and talking and learning to cope with things, you help others to cope with their situation. And that you're not always a patient. You're also a person.
Right.
You're outside of it. You have feelings, you have, emotions, you have a life,
Was it easy to
Yes.
open up in the beginning, or was it something that took gradual time to?
In my case, it took a little time. Like I say, he's the one who was calling me. But then it's because at that moment you only think, I have the chemotherapy. The chemotherapy make you feel very sick. You are very weak, and you don't even feel like talking in that moment. But when that period is over, you start to get that strength back. And when you see people positive, like they were very positive with me, and I became very negative, not thinking that I'm going to die or whatever like that, because I'm going to die anyway. That's one day is going to come, but not because I have the cancer and not because I'm depressed. So they helped me to keep going. So I'm so happy that I met them, and I give them the wings. They are my angels now.
And do you find now, as newer members come into the group, that they kind of lean on you?
Yes.
Yeah.
Yes. I found out people talking to me and seeing in a different way, like, I didn't know you were like that. I didn't know you went through this, and that made me feel good.
It's something similar to what we were talking about in the earlier episode about you being the therapist, you being the doctors, you being the healers, having empathy for others, giving to others, that's part of healing. And it gives you meaning to your life, new meaning to your life.
And being vulnerable, too.
Yeah. Cancer is all over the world.
Yeah.
And I have the fortune to have a lot of people around the world. And some of them, they talk to me and they have cancer. And they were asking me, how did you do it? How did you make it, when they are at the moment now.
Sure.
And it feels good to say, this is what happened to me, but can happen to you too. You have to be strong, you have to be there and accept. I accept everything. I accept the good, I accept the bad, and I accept them, so that's all. That makes me feel good.
Did your families also partake in the program?
No.
No. They listen to what I said, but they look at me like, that's what you want to do.
But it sounds like, just from listening to you in these few seconds, that through the program you found like an inner strength.
Yes, I did, definitely.
Like you said, like I'm done with being a cancer patient.
Correct.
And I guess you just needed that little push from Marty harassing you to take part in the program.
Right.
More of a healing group rather than a support group. We're talking about living versus like the other support groups I would go to, we would talk about our experiences of cancer. And you get to the point, you get tired of talking about that.
Right.
You want to get back to normalcy. Your family wants you to get back to the normalcy. And they're afraid of that black cloud that hung over your head.
Right.
Right.
Yeah.
But it's like a stage, that it moves from one mood to another. And then you are very down and you talk to Kelly or you talk to Marty. And they say, why? What happened? You have to do, whatever they say. Oh, they're right. So this group is good. Right. To me, it's good.
Well, as Marty had said
yes.
too also, I mean, Marty said, you don't use the word therapy, it's conversation.
Right.
And how important that type of terminology is, because when you think of therapy, you go to a clinical place of mind.
Right.
And you have conversations, as Marty was saying, as opposed to that. And I guess it's free-flowing conversations in the group, or do you pick a topic and...
Well, sometimes we don't talk just about the cancer or whatever. You talk about personal things sometimes, or in general. And that makes the difference on taking out of your mind that cancer word,
Right.
So when you said, well, now I'm like before, I can talk. I can say jokes like I used to. And but it goes slowly sometimes. But it's what you accept. And it's like what Kaylee said, no more cancer, forget about it.
Yeah,
and if it's
just move
coming back, we'll
forward.
fight it again. You know.
That's it.
Well, I'm guessing from the conversation we're having, and maybe Marty, you know more, they talk about those different stages of grieving. And so I imagine there's different stages when you're told
Of
the
course.
diagnosis like this. You go
Yes.
from anger, frustration, sadness, and hopelessness, and then I guess, Marty, is that a good analogy? Is that actually?
Yeah, but a lot of people think of those stages of grieving as mutually exclusive. You go from one to
One
another
to the
another.
next, right.
It's a lot more dynamic and fluid that we find ourselves skipping around.
Yeah.
And sometimes two experiences of those stages at once sometimes. It's a lot more fluid, a lot more dynamic,
Yes.
It's not that you're into one and then that's over into another. No, you keep going back to it, But it's important to be able to recognize, be aware, and to share it with people who are willing to listen and not tell you to feel otherwise.
Correct.
You know, one of the
Right.
things with accepting or whatever going, and because, women, my hair was always dark brown and, whatever. And all of a sudden, I finished this chemotherapy and I look at myself and I said, what is this? My hair is white now. It's not gray, it's white. And then little by little, it was growing the way I have it now, okay? And then I said, I didn't do nothing for that. It just came. And I'm not going to touch it. I'm not going to diet. I'm not going to do anything. This is part of my healing from the cancer. So some people like it like this. Some people don't. I don't care.
Well, I think
like
it suits you. I think it suits you.
Yeah.
And your families have gone on these journeys with you guys, so
Yes.
obviously they must see a change in
yes.
you
Yes.
from when you were diagnosed to now.
Yep.
Yeah.
They
Correct.
suffer too, right? They suffer.
Well, unfortunately,
way.
my husband's mother passed from ovarian cancer,
sorry.
so that was traumatic for him. And then I found the organization Tell Every Amazing Lady About Ovarian Cancer, and that helped them too to cope with it. But yeah, I had to fight because as a cancer patient or as a patient in the bed, I appreciate everybody that comes, but when they start crying at your bed, you feel guilty for being sick.
Yes.
And that's what gave me more fuel, like, okay, no. We can't have anybody more crying at my bed. We're getting
It's
out of this
true.
bed.
It's true.
I'm wiping your eyes, and we're going to run this race. you
Yeah,
know?
I guess it's human nature when you hear someone being sick, you want to be compassionate, and you see
Right.
that, like when people walk up to you, they're whole like, oh, it's like
Yeah.
it's like, could you just say hello and
Yes.
just be, so I definitely hear that, and not to dwell on the negative because I think what you're doing, it's so positive what you're talking about, but how do you even think about that notion of a possible remission, coming out of remission, a return of the cancer? Do you just...
Well, I was going to a faith healing group, and when I'm Catholic and the healers, I was always saying, oh, what if the cancer's back and da-da-da-da. And I said, what if it is? What are you going to do? I'm going to live with it, and I'm going to do what I need to do with it. And I'm going to give it in the grace of God, and I'm going to fight it. You have doctors here for a reason. And I'm going to use the best doctors as possible. That's why I have Dr. Florenza.
You're facing it as a stronger person. So the
100%.
experience is going to be different
Yep.
should it happen again.
I'm going right
Yeah.
now to the test that you have to do every 6 months, like Kelly said,
Yeah.
whatever. And they found another spot on the only lung that I have, little thing. So they continue checking on it, but I'm okay. If it is, it is.
But,
And I mean it. I'm not trying to be funny or
No, you can
or
see it in your
anything.
face. You're genuine
I mean
what
it
you're saying, yeah.
Because if they were able to take that big thing that I had on there, this is a tiny little thing, they will.
And there's nothing you
And
can
the prayers,
do.
prayers,
Yeah,
they
prayers,
help. No
yeah.
matter what religion you prayed or whatever, the prayers go to the right place.
And there's nothing you can do with that cell.
Right.
There's nothing you
Exactly.
can do but to get medical attention for it.
Right.
Worrying about it, obsessing about it, there's nothing you can do.
No.
And it
You know?
sounds like you've been in good hands throughout.
Yes.
And you've thrown out Dr. Forlenz's name
Yep.
so many
Yes.
times. And
Yes.
Dr. Forlenz has been with RUMC for so
Yes,
long.
yes.
And now he's heading up palliative care, which is just as important as the actual, palliative care has actually, that program has taken off. And that's why it's important for people to know about this program that Marty has going as well, because of what it can do for people. And we talk about the mental, it's very easy to talk about the clinical side, so to say, in the treatment. But when you think about the psychological and the mental and the emotional tolls that it takes, having an outlet has
That's
helped.
good.
We talked earlier about PTSD, post-traumatic stress disorder, and prolonged traumatic stress disorder. But it's traumatic.
It is
And the research is in. What helps, what heals trauma is not 50-minute psychotherapy, blah, blah. It's the consistent, caring relationships that a person develops that helps recover and healing. That's what it is. It's that consistency, it's that caring.
Yep.
I know, because
And the competence that comes along, good information.
the family suffers too.
Oh, yeah.
And then sometimes they need more help than the person who is ill, because they don't know what to do. They don't know how to handle it. And they feel, why is she like this? It should be like that. And that helps too.
Yeah, they say a lot of times that families suffer in silence
Yes.
because they're
Yeah.
being so strong for so long for someone else
Right.
that when they feel that if they break down in front, who am I to break down in front of you when you have cancer? And,
Right.
But it's human emotion. It's
Exactly.
human. And what have you learned about yourselves from your diagnosis and this journey that you've been on?
What did I learn? I learned that I'm smart because I'm going to the right people. I listen. And sometimes it looks like I don't know what I'm saying or what I'm doing, but I listen. And then you analyze those words and you go to the people that they are talking to you and you listen to what they said. And I may find out that they are right or they are wrong. And I put my opinion in there and we work it out together. So I learned that I can come out from that with the right people.
And I've learned to live because I was given 6 weeks.
That
Really?
was something, yeah.
Yeah, and Dr. Florenzo was just like, I don't know how you got through all of this, but through my faith, I believe it taught me to live. And
So you were given 6 weeks to live.
yeah,
Yes.
6 weeks by the
Wow.
emergency, because I like a 58th girth. I had over 1,500 milliliters of ascites drained out of me.
Wow.
It was by the grace of God. It was a divine intervention.
I can't imagine. How do you process that?
I felt like somebody threw me up against a cement wall. And I was in the emergency room. Life got so loud. The noises got so loud. And then I said, if I make it through, I'm going to live a better life. And I'm going to live. I'm going to stop worrying about dying. Because we all are going to
die.
eventually.
Yeah.
That's a given.
Right.
Yeah.
That's a given. But how I'm going to go out, I'm not going to go out this time.
And how long ago were you given that diagnosis?
6 years ago.
6 years ago.
Yes.
Wow.
Yes. So for 1 year, I counted every day. I survived 1 day, 2 days. When I got to 365 days, I said, what am I doing? I'm freaking living. I mean, it's mind over matter. But I remember when Dr. Florenza, when they did the analysis, and they did it twice, I remember he said, you got a lot of work to do. And he said, only you can do it. Because I was thanking him. I was like, oh, thank you very much for being kind. He said, I'm not doing nothing. He goes, you have to do the work.
Wow.
And, and I like him because he's firm, he's stern, and he's professional. And that's who cancer needs to have to beat it.
So, I mean, sometimes
Yeah.
I think you need that type of a sternness to kind of
100%.
kick in the...
And strict, too. And, like not missing appointments. And, because as a cancer patient, you can get a little skittish. Like, oh, I don't want to go. I don't want to go to the appointment, But he's like, nope, you come to the appointment or you don't come.
And when you know that he cares because he's genuine, and that's true with all of our doctors, then you could be firm and you accept it because you know he cares.
Yes.
Or the treatment team cares.
Yes, yes. Yeah.
I had a very emotional moment when I get off. I had my last treatment, and I go in the lobby there, and the nurse told me, go and ring the bell. And I'm looking and ring the bell. I have no idea what was the bell because I am in another world, you know. So I felt like I was in school when I was little, and I go and ring the bell because it's time to go out or whatever. And I rang that bell, and everybody in the office came out and applauded. Good, good, you did it. And that's for me. I got it. I said, I'm free.
Wow.
That's it.
Wow, that's great.
Well, both of you, I mean, inspiration is like not the word that but that's clearly what I feel from listening to both of you. If someone's watching this episode and is in a spot where you were, what would you say to them about what they need to do, and how would you tell them that this program can help them?
I would say, have faith. I am, like Kelly, very religious too. Religious to the point of myself, me and God, you know, health. And then see and talk to the doctors, tell them what you feel. Because sometimes if you don't say what you feel, how can the doctor know the feeling? He can know about the disease you have and everything else, but tell them what you feel. And that, to me, is what is keeping me going. Because the doctors that I go, I tell them what I feel, and they found a way to walk me out.
Great.
And I would say that you can survive, you mean cancer, and the disease doesn't define you, you define the diagnosis. And to treat yourself the best way you can and love yourself, because it's only you running that race.
Yep.
And holding on to other inanimate objects is not going to get you through it.
Well, that's been, this has been a fantastic conversation, and it is so wonderful to hear your stories and that you're doing so
Thank you.
well.
Thank you.
Marty, thank you again for joining us. If you'd like to contact the Family Care and Support Program, you can call 718-317-0745. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for nearly 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks again for joining us. I'm Alex Lutz.